Welcome to Deuk Spine Institute. This will be our 5th surgery for today, July 25th, 2024, and our last. Our patient has back pain and buttock pain. Her buttock pain is here in the buttock on the right side. That is the piriformis muscle. That's exactly where it's torn. The piriformis muscle this is the sacrum. It's a bone. The piriformis muscle runs from its attachment on the bone all the way over to the top of the hip where it attaches, and it is painful when it tears. We're going to deal with that later. But first we're going to fix the L5-S1 disc, which is damaged. I never did great in art class. That's why I became a surgeon. All right, do we inject? No? Yes? A little bit. Little numbing medicine. So our patient is awake for the very beginning of the surgery. I need her help. Yes, it's a her. Yeah, everything's good. You're doing awesome. Don't move. You're doing perfect. Just gave her some numbing medicine, just like the dentist gives you numbing medicine before they start drilling on your teeth. Okay. Now, L5-S1, she's got several disc herniations, but 5-1 is the worst. That's where most of her pain is. So I've got to choose an entry point. Lay still. You're doing all right. I want to give the medicine a moment to work. And I'm going to use this needle to go in and get into that L5-S1 disc. I think it's a little too low. It's not bad, actually. So unlike the last patient, this patient's spine is a lot closer to the back. Shot? Which I think the powers that be. 4. Shot? Okay. If my grandmother was here in the operating room, she would say, "Tank Scott." Tank Scott. Ada, Tank Scott. AP. She was this sweet little old lady from Armenian descent, but from Egypt. And she grew up her entire life in Egypt and honestly barely spoke English. But she did speak a little. Okay, you can see where the needle is on the right side. It is approaching the 5-1 herniation. The nice thing about our surgery here is that we actually don't do any damage to the body. We go through a hole that's already in the spine, John. It's called the neural foramen. It's there already. You can kind of see it. And that's a hole where the nerve comes out, which, oh, by the way, if you have a pinched nerve, I can fix it while we're here. Okay, so we're in. And any questions?
At this moment, no current questions.
You have any questions? Oh, I'm Dr. Deuk. We're here. You're doing awesome. We're going to put you to sleep in a minute, okay? How long have you had back pain for? How many?
How many years? We couldn't hear you.
34 years? 40 years?
40 years.
40 years. That's so sad. All right. Well, we're going to fix that, at least most of it today. Are you comfortable? What she said, make sure what?
What'd you say?
She's very chatty.
All right.
Said make sure I do a good job. Oh. Well, there we go. That was fascinating.
Can I have more indigo, please?
That was, I've never seen that in my entire life. I've been doing this for a long time. Did you guys see that? The syringe cracked.
Yeah, we saw that. That
What
was
does it say? Made in China? I'm just
Wow.
kidding. Well, no, we don't need it.
No.
How bad is that on a scale of 1 to 10?
Give us a number. A 4.
Fuck it. Well, unfortunately, I couldn't get any pressure. You don't have any more, right?
No.
Yeah. Well, no, you do.
Want it?
All right, why don't we try? This whole syringe is just cracked. I've never seen that in my entire life. How many thousands and thousands of surgeries have I done?
I've never seen it. How many syringes have I used?
That was crazy. I have to say that was a bit unexpected.
Dodging like dodgeball.
Right? You hit the ground like somebody's opened fire.
Yeah.
All I could see was his head, and then all of a sudden,
All right. Are you comfy? Let's try this again. Yeah, I probably hit the wall. How bad is that on a scale of 1 to 10? 10? All right, so I knew 4 was too low. That was a 10. Is that where you get your pain? Perfect. All right. You get to go to sleep now. When you wake up, that pain will be gone permanently. So good news. All right, so I just want to point out, the last patient, his spine was literally like a foot lower down in the body. They both, the last patient we did and this patient, are both about the same build. They're both in, and for him, the needle, this lady, the needle's like this. For the other guy, the needle was like that, because I had to go like a, look at that. Okay, for the other guy, we did L5-S1. This was touching the skin. That's how much deeper his spine was. Anyway, the reason I point this out, it's just fascinating to me. You're fine. Lay still. Maybe I'll wait a minute. Let's give some more, any more numbing? Henry, any questions?
At this moment, no current questions. So in the meantime, let's show the audience of what are the 30 causes of back pain.
Yeah, 30 most common causes of chronic back pain. I'm Dr. R. Deuk Majin with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Majan. Thanks for joining us. Some people fish. At Deuk Spine, we take herniated discs out. Look at this piece of herniation we just took out. 2 centimeters long. Smack it and give it an APGAR score. That's a piece of herniation, folks. Nice big one. Doesn't break any records, not here at Deuk Spine, but it's still impressive. Okay? All right, we were just talking about movies, which is what we talk about when you guys aren't here. And we were just talking about a movie called From Dusk Till Dawn. Here comes another piece of herniation. Not as big. Okay. Any questions, Hen?
Yes, we have a question coming from Essential Advantages on YouTube.
Essential Advantages? Yes, we like your questions. You may ask questions.
They ask, do a lot of people still need surgery after spinal decompression therapy?
I'm sorry. I have to catch my breath. That's like saying, do we still need to go have dinner after we've eaten air for the last hour? I mean, spinal decompression therapy is chiropractic treatment. And if your problem is a disc problem, there's a 100% chance you're going to need surgery. This surgery, of course. Chiropractic treatment doesn't fix disc herniations, period. I know they all want you to believe they can. Maybe you're a chiropractor, maybe you're not. But honest to God, let's pretend you spent a week in the Mexican Sonoran Desert, walking around looking for food and water. Do you still need to drink water after 1 week of not having a single drink if all you've had is air? Of course you do, because you haven't had any water. Spinal decompression therapy doesn't work. It's basically, I hate to say it, and chiropractors will hate me, it's just a scam. Spinal decompression therapy this is what it really is. When you have a painful disc or a painful back, so you hurt something, if you just wait 6 weeks, the pain will probably go away, at least 50% of the time. It'll go away temporarily. So what is spinal decompression therapy? It's where the chiropractor says, when did your back start hurting? Yesterday. All right, in their mind they calculate, I've got you for 6 weeks before that pain goes away. So let's do spinal decompression therapy for 6 weeks. You'll pay me for every visit, and 50-50 chance your pain will be gone. That's it. If you don't go to spinal decompression therapy, you still have a 50-50 chance your pain's going to go away. Okay, but it is going to come back until you have the Deuk laser disc repair. Any more questions?
No current questions, but we do have a comment coming from Essential Advantages on YouTube at
Yes.
saying, okay, I feel better about that then, that I am getting your surgery soon then.
Yeah, honest to God, man. Listen, my sister's a chiropractor. She does spinal. She doesn't do spinal decompression therapy called VAX-D. VAX-D, V-A-X-D. It's a machine. She doesn't do it. She's a chiropractor. For 40 years, she's a chiropractor. She doesn't do spinal decompression therapy because she said it's a scam. She's a chiropractor who said it's a scam, and she's right, it is a scam. She doesn't do it because it's a scam. Now, chiropractic itself is not a scam. Manipulation's wonderful. Facet joint manipulation, SI joint manipulation, all those, range of motion and massage and those procedures they use where they do manual treatment is wonderful. We believe in it. We send our patients for it at times. But VAX-D, spinal decompression therapy on that machine, that is the scam. And that's all I'm saying is a scam. Chiropractors is not a scam, but some chiropractors do that machine because it makes a lot of money. And they got to make a living. But the truth is, from a patient standpoint, it's unnecessary. It doesn't really do anything. Okay? That's why my sister, who's a chiropractor, and a very good one by the way, doesn't do it, because said it's a scam. When a chiropractor says something is a scam, you better believe it's a scam.
We have another question
Yes.
coming from Kieran on YouTube.
Hello, Kieran. Welcome. Welcome to our live stream. So just so the rest of the audience knows, I want you all to look here. You're seeing inside the tube, this where you see the circle is the end of the tube. The end of the tube is in the herniation. And we talk about, do we show them how the disc causes pain yet?
No, not yet.
We're going to show you in a minute a video. Thank you, Jordan. And in that video, you're going to see what this pink stuff right here is. This is inflammatory tissue. It shouldn't be here. It should be white. But there's a tear, and there shouldn't be a tear. And there's inflammatory tissue because there's inflammation happening. So before we take the question from Kieran, let's just let the audience see, how do these herniated discs cause so much pain?
Copy that.
Disc injuries start with an annular tear, damaged nucleus. Pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals.
Okay, so you can see from our video what I'm talking about when I talk about the inflammatory tissue. Dr. B, I got about 2 minutes max on this, and then we're going to go to the piriformis. So we'll take the questions because we're going to end the stream in about 2 minutes, and we're going to do the second part of the surgery, which is the piriformis muscle release for piriformis syndrome.
Kieran on YouTube asked, good afternoon, Dr. Deuk.
Good afternoon, Kieran.
Hypothetically, if all the nucleus pulposus is taken of or extracted out of the disc, would it matter to the mechanics of the disc or the spine?
Great question, Kieran. So Kieran, the answer is it would affect the biomechanics of the spine for sure, but the real question is, would the patient notice that? And the answer is no. The patient will not notice any difference. Now, if you said, Dr. Deuk, if you took all the nucleus pulposus out of all the discs in your spine, that means all your discs, lumbar 5, cervical 6, thoracic 12, would the patient notice? Absolutely. That's too many discs, and that's too much biomechanical change. But if you're talking about 1 or 2 or 3 nucleus is being removed, The patients never, they will not notice it. You can be a professional soccer player and not notice it. By the way, Kieran, if you look at people over the age of 45 and get MRIs on everybody who's normal, you'll see that 90% of them have discs that are gone, completely gone, bone on bone, and they have zero symptoms. That's how we got this information as doctors. We don't just imagine it, we actually look at studies that are done. And the study was done in Japan, and it was done about 25 years ago, where they got MRI on all these people off the street who had no symptoms of back pain or neck pain, and they found that 90% had herniated disc, degenerated disc, some kind of disc problem, and they have zero symptoms. We're pretty much done here. So is there any other question?
At the moment, no current questions.
All right, we're going to end this live stream, and we're going to do the piriformis muscle release next, because this patient not only has a painful disc in her back, but she also has a torn muscle in her buttock. And when you get a torn muscle in your buttock, it really never heals. And this treatment we're about to do is the newest and best treatment in the world for that muscle tear. Okay. Done. This is it. Cleaned out this disc tear. It looks really good. Let's see if we can see the nerve. Nerve should be right there, but it's in the fat. And maybe I can clean that right there. We get one last piece and then we're done. Any other questions?
At this moment, no current questions.
Just underneath the nerve root, I should say. All right, that's it. You guys can see the what's left there of the tear is about 3 or 4 millimeters. It will close itself in time. It just takes about 9 months to go away, and the body will heal it, just like it heals a cut on your skin. But now it can heal because we cleaned out the stuff that was in there. Have we shown how the DLDR works?
Yeah, we can close that out with that.
All right, very good.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349